The aim of this event really is to showcase the entirety of the specialties that's on offer at Orange Health Service, and also to provide a networking event between the junior doctors, the senior medical students, as well as the senior specialists.
Some of these students, because they only spend a year with us, the other time they are in actually metropolitan areas where they would probably be very hard put to get such a lovely experience as being able to talk informally to consultants, having a drink and delicious food.
Today it's very informal, very casual as you can see. We've got a few specialists in groups arranged in tables, and the students and junior doctors will take 8 minutes at each table, like a speed dating service, but for medicine, for doctors.
I learned plenty tonight. I learned a lot, and I think the best part about all the clinicians here, and you speak to people about what you want to do, and they are just, very happy to just, either tell you that there's other options or there's things available or help you facilitate what you want.
The benefit of events like tonight is that you really are shown different perspectives and different ways of seeing career paths. You're really shown how flexible medicine can be as a career and the options that are available to you within Orange.
Tonight's been really good in terms of being able to talk to a whole bunch of different surgical specialties as well as O&G, and then just to hear little bits and pieces from different specialties that perhaps I haven't really heard much about, or people I haven't really met with or interacted with before, as well as just meeting people who I work with in the hospital or different specialties that I'll have to interact with, and building some rapport.
I think these events are so important. My main purpose for coming this evening was to talk to the interns and residents about the things that I wish I had been told as I came up through my training. I think there's a lot of misconceptions out there about, taking time out from your training, exploring other things, taking time to travel and really get to know yourself as a person before you decide on a specialty.
One of the main reasons I wanted to come was to fly the flag obviously for surgical specialties in general, but also just that connection with the medical students that we don't necessarily get all the time, but we get to do a little bit extra. It's always interesting to see how early people have started to think about what they're going to do and where they're going to work, and having such variety in the kinds of things they're interested in.
I think the main questions for Dr. Zielinski and I as an oncologist is about why we enjoy the specialty. I think that, there's a lot of people's perceptions of oncology is that it's a very sad specialty, and how do we deal with that? What are the things that make us tick? What do we enjoy the most about our job? We see patients that they're most vulnerable, and it is a real privilege to look after them. So it's sharing that with the trainees today and helping them understand that about our specialty.
A lot of the advice we're getting tonight is more general, speaking to an orthopaedic surgeon, not about training towards orthopaedic fellowship, but what makes a good life as a doctor and how to balance your needs with developing your medical career.
Challenge yourself, make an impact.
Shape the future.
Join us.